For today's discussion, we're going to discuss about supraventricular tachycardia in a pre-arrest setting. If you want to know more about that, stay tuned. Hi everyone, welcome back to my channel. If you're new here, my name is Galve and I'm a registered nurse and I do have a degree in medical surgical nursing. I create nursing educational contents to help nursing students with their studies. If that's something that you are interested in, consider subscribing. If you're already subscribed though, thank you so much for your love and support. I see you. I upload my nursing educational contents 2 to 3 times in a week, so don't miss that out. Subscribe to my channel, you hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, let's jump into the video. For today, we're going to discuss about supraventricular tachycardia in line with your American Heart Association. I'm going to teach you exactly the algorithm to follow the most easiest way for you to remember the concept of supraventricular tachycardia in a pre-arrest setting, okay? So in order for me to do that, I will switch back to my PC and I'll see you guys in a bit.
Hi everybody! Welcome nga sa ating formal discussion ng iyong supraventricular tachycardia o ang iyong SVT. Now, mind you guys na this discussion is actually in line with your American Heart Association. This module is about how to manage SVT in a pre-arrest setting in accordance with your AHA. Now, this video we're really gonna help those healthcare professionals who will be getting certification for your AHA, yung sa iyong ACLS. So this is a preparation for all of you guys and just a constant reminder on what is the algorithm that is to be followed when it comes to your SVT sa pre-arrest setting. Now, I'll be putting some links to the websites sa description box para naman makatulong sa iyo kung gusto mong ma-check out yung some other information. I'm also gonna put there a specific link kung gusto mong ma-try yung knowledge mo or you wanna have more quiz, okay? Now, let's proceed. To start with, I would just like to give you the objectives of our today's discussion. Okay, first we're going to define SVT. Then we're going to talk about symptoms and diagnosis. We're going to define and we're going to explain what is the difference between stable SVT and unstable SVT. We're also going to discuss nursing management. Importante yon. Importante yon. And sa dulo, you guys, you need to listen to me because we're going to have a short quiz. Oh, no. All right. So, let's answer the question, what is supraventricular tachycardia? Now, based on the definition, SVT, or also called paroxysmal supraventricular tachycardia, is defined as an abnormally fast heartbeat. Mamaya i-discuss natin yan. Now, let me be straight with you guys. When we talk about SVT and when you heard about SVT, it means that a heart rate greater than 150 with conduction at or above the AV node. Okay? Okay, normal values tayo. Ano bang normal values natin again? So, heartbeat natin, it's 60 to 100 beats per minute. A heart rate more than 100 beats per minute is called tachycardia. This occurs when the electrical impulses that coordinates your heartbeats don't work properly. It may feel like a fluttering or racing heart, hence yung tinatawag nating palpitation. But I really want you to pay attention here sa ating normal values, ha? Now, let's proceed. Para maunawaan na natin kung ano yung SVT, we're gonna define ano ba nangyayari sa normal sinus rhythm versus sa supraventricular tachycardia. I don't know if this one is clear to you, but I hope it is. So you can see here, this is your NSR, normal sinus rhythm. This is your SVT. Now, normal sinus rhythm or electrical impulses spread from the sinoatrial node, ito po siya SA node, across the atria to the atrioventricular AV node, and the right atrium. Electrical impulses reach the ventricles by passing through the AV node, his bundle, and the right and left bundle branches. The right and left bundle branches extend along the ventricular septum, which conduct the impulses to the ventricular myocardium. Now, supraventricular tachycardia, on the other hand, occurs when a faulty electrical connections in the heart or abnormal areas of electrical activity trigger and sustain an abnormal paroxysmal rhythm. When this happens, the heart rate accelerates too quickly and doesn't allow enough time for the heart to fill before it contracts again. These ineffective contractions of the heart may cause the patient to feel lightheaded or dizzy because the brain isn't receiving enough blood and oxygen. Alam naman natin na very important yung enough blood flow sa ating mga vital organs such as our brain. Don't worry, we're gonna talk about more about the signs and symptoms, okay? Alright, so this is your sample ECG. Kung hindi ka pa nakakita ng ECG ng SVT, ito po siya. Napakaraming sample ng mga SVT, hindi ka mawawalan, okay? SVT, this is a broad term for a number of tachyarrhythmias that originate above the ventricular electrical conduction system o ang tinatawag nating Purkinje fibers. Classic paroxysmal SVT has a narrow QRS. Ito QRS. Classic ha? And has a very regular rhythm. Inverted P waves are sometimes seen after the QRS complex. These are called retrograde P waves. There's actually several types of your SVT. Nandiyan na yung atrioventricular nodal reentrant tachycardia, yung AVNRT. Nandiyan na rin yung AVRT, atrioventricular reciprocating tachycardia, atrial tachycardia.
Ano daw, girl?
There's some other types of supraventricular tachycardia. This includes sinus tachy, inappropriate sinus tachycardia o yung IST, multifocal atrial tachycardia, yung MAT, junctional ectopic tachycardia, JET, JET, non-paroxysmal junctional tachycardia, and PJT. What did I tell you? Napaka-broad ng spectrum na to. Now, mind you guys, just for your reminder, for this discussion, we will focus on the pathway of choice for SVT in the tachycardia algorithm based on whatever the patient, whether the patient is stable or unstable based on the AHA guidelines, okay? Now, symptoms and diagnosis. The heart fails during diastole, and diastole is normally 2/3 the cardiac cycle. A rapid heart rate will significantly reduce the time which the ventricles have to fill. The reduced filling time results in a smaller amount of blood ejected from the heart during systole. The end result is a drop in cardiac output and hypotension. With a drop in cardiac output, a patient may experience the following symptoms. These symptoms occur more frequently with a heart rate of more than 150 beats per minute. 150 beats per minute. That's when the symptoms occur, okay? Now, ano-ano ba yung mga sinasabi nating symptoms? Meron ka nandiyan SOP, na andyan na rin yung palpitation, na andyan na rin ang inyong chest pain, ongoing chest pain, yes. You also have your dizziness, rapid breathing, tachypnea, loss of consciousness, and sometimes numbness of body parts. Next, ano bang confirmatory? Ano ba yung diagnosis nito? Simply lang ECG, okay? Now, a definite diagnosis of SVT can only be made through ECG documentation. Although obtaining documentation can be difficult due to the unpredictable nature of SVT, ambulatory ECG monitoring can be helpful to document SVT in those that experience frequent and transient tachycardias, okay? We're gonna talk about stable versus unstable. Now, ano nga ba? Paano mo nga ba ma-define kung stable or unstable ang SVT? Actually, kapag nag-take ka ng certification mo sa AHA, sa pre-arrest setting, you're gonna deal with, trust me when I say that you're gonna deal with SVT at hindi mo yun tawag dito? Maiiwasan, hindi mo yung pwedeng lampasan because dadaan ka muna sa pre-arrest and then arrest and then post-arrest setting. Actually, tuloy-tuloy yung algorithm na yung kapag nag-return demo ka na. Now, papakitaan ka nila ng readings sa ECG, tapos you just have to define, once you already identify that that is SVT, the next question for you really is to identify if it is stable or unstable. Again, wag malilito kasi we're talking about pre-arrest, okay? Huwag kang mag-alala kasi I'll give you on how can you easily remember these concepts, the stable versus unstable, okay? Now, as per American Heart Association, the pathway of choice for SVT in the tachycardia algorithm is based whether the patient is stable or unstable. Number one criteria for you to identify if your patient is stable or unstable. Blood pressure. Yes.
According to American Heart, it is your blood pressure.
So wag malilito. They will give you the reading. All you gotta do is to identify. Next, what is your next goal? You will identify if it's stable or unstable. Kasi depende doon kung ano yung algorithm na susundin mo. Sa pag-identify whether it's unstable or stable, you need to look for the blood pressure. Normal values tayo ha. Ideally, sa mga libro, nakikita natin na 120/80. Okay? But according to American Heart Association, it's actually, tandaan mo to my loves, 90/60. Ideally, sa mga libro, wag malilito, 120/80. Sa American Heart Association, ang value na tinitingnan nila is 90/60. Okay? Supraventricular Tachycardia, dalawa po yan.
Okay, stable SVT.
Anong sabi ko? Tingnan mo siya. Masasabi mo stable ang yung SVT kapag ang blood pressure mo is what?
More than 90/60 millimeters of mercury.
Tandaan. Paano naman kapag unstable? May idea ka na? Very good. When we talk about
Unstable bradycardia, your blood pressure should be less than 90/60 millimeters of mercury.
madali lang siyang tandaan, hindi ba? So ganito, bibigyan kita ng tip. Once na-identify mo na SVT ito, based dun sa ECG reading mo, what you're gonna do is to look for the blood pressure. Kapag ang blood pressure mo is 120/80, that is more than 90/60, you will call that stable SVT. Isa pang scenario, pag binigyan ka ng ECG reading, tapos na-identify mo na SVT siya, you need to look for directly, anong next mong hanapin? Yung blood pressure mo. Kapag na-identify mo na ang blood pressure mo is, let's say, 70/40.
Oh no!
Ano to? Unstable SVT. Okay?
So identify the reading, then look for the blood pressure to identify if the patient is stable or unstable.
Gets? So, ready ka na ba? Ito na ang ating nursing management. Okay. Again, ito yung concept na gusto kong matandaan. Once na-identify mo na stable brady. Oh, by the way, speaking of stable brady, I actually created a discussion about bradycardia. So, if you haven't watched that, I suggest that you check that out and then you come back here, okay? Ano nga ulit tong gusto ko tandaan mo? Stable. Stable SVT, ang blood pressure ko noon is more than 90/60. Anong management? Ito lang gusto ko tandaan mo.
2-piece.
Yes. 2-piece. Kung may hindi 4-piece ha, 2-piece. Yung 4-piece para yun sa sa mga nasa laylayan.
Katulad natin. Chareng!
Ano ibig sabihin ng 2-piece? Padaliin mo ang buhay mo. You have your physiologic and you have your pharmacology. When you talk about physiologic, isa-isahin natin yan. Ano to? Carotid sinus massage. Nurses familiar?
Ano daw?
Isa ito sa mga klase ng mga vagal maneuvers natin ha. Now, reviewin lang natin. When we talk about vagal, Bisaya ka girl. When we talk about vagal maneuver, this is a technique by which you attempt to increase thoracic pressure, which stimulates the vagus nerve. This can result in slow conduction of electrical impulses through the AV node of the heart. Ano tong carotid? Huwag malilito. Yung carotid sa CSM, yung carotid sinus massage, that is one way or one methodology of vagal maneuver. I-define natin to. When we talk about carotid sinus massage, this is a simple bedside maneuver that helps to clarify the type and sometimes also the mechanism of different rhythm disturbances. Anong rhythm disturbances natin dito? SVT. Now, the major indication for carotid sinus massage is the diagnosis of tachyarrhythmias, in which the atrial activity is either absent or intermittently present. Guys, meron pong contraindication itong CSM natin. Ano yon? Kapag more than 60 years old ang pasyente mo, tatanungin nila to sa AHA. So, watch out ka dito. Sa pagbibigay pala ng demographics ng pasyentes, bibigyan kanila ng patient information, you need to pay attention dun sa age, okay?
Kapag more than 60 years old, ang sabi, huwag magbigay ng CSM.
Bakit? It is important to realize that there is a small risk of stroke if there is a carotid artery plaque. Common sa elderly, yung may mga plaque na sila sa kanilang carotid artery, and we really want to avoid that only because it can travel through the heart and can cause further damage sa sa kondisyon ng pasyente mo. Na absolutely, contraindications to carotid sinus massage include myocardial infarction, transient ischemic attack, or stroke within the preceding 3 months. So those are your contraindications. Now, what you're gonna do? What's your next step kapag hindi pa pwede ang CSM? Tatanungin ka rin nila dyan. So, your next step, what's your next step of methodology? You can introduce cuff method. Now, a cuff stimulates an increase in intrathoracic pressure which will stimulate the vagus nerve. This can result in slowed conduction of electrical impulses through the AV node of the heart, okay? Now, please note, vagal maneuvers alone or valsalva maneuvers, pareha lang yun vagal, valsalva maneuvers, everything is just the same. Carotid sinus massage, cuff method, and some other forms of your valsalva maneuvers, those are the types. Okay, wag malilito. Carotid sinus massage will not terminate about 25% of your SVTs. Adenosine is required for the remainder. For yung ating pharmacology, may idea ka na.
Adenosine, that is the drug of choice for your stable SVT.
Aralin natin yan. When we talk about pharmacology na dito sa iyong stable SVT, ito yung mga concept or mga terms or ano bang tawag dito? Yeah, concepts na gusto kong tandaan mo. Adenosine, ang dosing mo, 6 mg, 12-12. 6-12-12, 6-12-12. Madali lang tandaan, di ba? Ang interval mo, ilan? 1 to 2 minutes. Alright? Adenosine is the primary drug used in the treatment of stable, narrow, complex SVT. Okay, anong contraindication ng yung adenosine? This may actually cause bronchospasm. Therefore, adenosine should not be given to patient with asthma or chronic obstructive pulmonary disease, yung mga COPD patients natin, such as yung mga may asthma, may emphysema. Why? Because this can actually aggravate their condition and can cause bronchospasm. So, hindi ka lang nag-cause ng airway and breathing problem. Kung ang problema mo lang is circulation, nag-introduce ka pa ng airway and breathing problem. So, be cautious, ha? One few reminders then, when you're giving adenosine, tandaan mo na
You should give it a rapid IV push in a large vein and flush it with what? Normal saline.
ano ba yung mga large vein natin? Pwede mo siyang ibigay sa antecubital fossa, or kung wala namang wala namang contraindication, or you can actually try to give it saan sa iyong cephalic vein, only because those are the veins that are very much accessible, lalo na sa mga pre-arrest settings, sa mga emergency cases. Okay, my loves? Again, wag malilito, ha? Stable SVT, ang blood pressure ko is more than 90/60 millimeters of mercury. Dalawang management ko dyan. Two piece. Physiologic pharmacology. Una, ika-carotid sinus massage ko to dito sa neck ng aking patient. Pero kailangan ko munang maging mindful sa age. Ano ba yung age ng pasyente ko? Kapag more than 60 years old, hindi ako magka-carotid sinus. Ang gagawin ko, pauubuhin ko siya ng 3 times. That is your valsalva maneuvers. Now, 25% lang kasi ang pwedeng ma-manage nitong valsalva maneuvers. Ang next ko ng course of action is what? Adenosine, which is your pharmacology. Pharmacology. Isa lang ang drug of choice when you talk about stable SVT, adenosine. Ano yung dapat kong tandaan? Dosing and intervals. 6 mg, 12 mg, 12 mg in an interval of 1 to 2 minutes.
Period. Ang dali lang, diba?
Tapos na tayo sa stable SVT. We're now gonna talk about unstable SVT. Ano ulit ang concept na gusto kong tandaan mo? Pag sinabi mo siyang unstable because your blood pressure is what? Less than 90/60. Now,
Anong gusto ko tandaan mo? 2S naman. 2S.
Okay, ano tong 2S na to?
Sedate, synchronized cardioversion.
Ano yung mga drugs that are classified as a sedative agent? Ano to? Diazepam, midazolam, propofol, and etomidate. These are the drug of choice that is recommended by your American Heart Association to sedate your patient. Itong synchronized cardioversion, familiar ba kayo sa concept nito? When you talk about synchronized cardioversion, according sa AHA protocol, I just really want you to remember this concept. Trust me, ito yung hinahanap nila.
At ito yung gusto nilang marinig sa bunganga mo, ha?
So kapag nag-synchronized cardiovert ka,
50 to 100 joules.
ang recommended ng AHA.
And then you need to wait for the patient's muscle to what? To contract.
This is actually a good indication na na na-deliver mo o yung na-effective ang yung synchronized cardio version aside sa pag-check ng ECG kung nag-normalize na ba yung rhythm. Bakit hindi po pwede mauna ang synchronized cardiovert dito sa sedation? Girl,
Kukulitin mo agad yung pasyente mo ng gising na buhay ang kamalayan. Nagigigil ako dito sa'yo.
tandaan mo sa pre-arrest setting, conscious pa ang pasyente mo ha. Mag-unconscious lang ang pasyente mo kapag nasa arrest setting, nasa arrest phase ka na. So different na ang management doon. You're not gonna talk about SVT and Brady anymore. You will talk about yung pinaka-arrest algorithm ng iyong ng iyong AHA protocol. Synchronized cardioversion for unstable patients with SVT and a pulse are always treated with synchronized cardioversion. The appropriate voltage for cardioverting SVT is 50 to 100 joules. This is what AHA recommends, and also SVT converts quite readily with 50 to 100 joules. Again, ano manage mo na yung unstable SVT? 2S, sedate, synchronized cardioversion. Sa sedation ko, pwede akong gumamit ng diazepam, midazolam, propofol, and etomidate. And then, kapag nasedate ko na siya, pwede na ako mag-introduce ng synchronized cardio version. Ang joules ko is 50 to 100 joules. This is in accordance to AHA. Kapag nag-introduce na ako ng synchronized cardio version, I will have to wait for the patient's muscle to contract, yung nagjo-jerk. Tapos na tayo guys. Ayun lang yon. Ready ka na ba? Ito na ang ating short quiz. Nako, malalaman na natin kung may naintindihan ka talaga ha. Push. Okay. I'm gonna give you like 5 minutes to answer this short quiz. It's 10 items. And then I'll be back with you shortly. Magra-rationalize tayo. Here we go. Alright, welcome back to me. Chareng. Okay, kumusta ang exam? Nag-enjoy ka ba? May mga nahirapan ka ba dyan? Okay, now, simulan na natin. Sagutan na natin to lahat. I-change ko lang yung cursor ko para laban na laban. Okay? Now, question number 1. Tachycardia is defined as an arrhythmia with a rate greater than 150 beats per minute yan actually. B, an arrhythmia with a rate greater than 100 beats per minute. And any arrhythmia disorder with a heart rate less than 60 beats per minute. An organized rhythm without a pulse. Anong sagot dito? Tachycardia is defined as arrhythmia with a rate greater than what? 100 beats per minute. Sagot dito is B. Maaring may iba sa inyo sumagot dito 150 beats per minute. Tandaan mo na itong 150 beats per minute as discussed on this module na dito nagsastart mag-manifest ang symptoms niya. Pero technically when you talk about tachycardia, it is babalikan mo yung normal values mo. Ano ba normal values mo? 60 to 100. Now this is actually in accordance to AHA Advanced Cardiovascular Life Support Provider Manual, page 130. Bitch, I have a page reference. Check that out. Okay, next. Question number 2. Synchronized cardioversion is recommended for A, monomorphic VT in a stable patient. B, pulseless rhythms. C, unstable SVT, polymorphic VT.
Gigigil lang kasi pag mali ka dito, ha?
Ang sagot natin is what? Synchronized shocks are recommended for patients with unstable SVT, unstable atrial fibrillation, unstable atrial flutter, and unstable regular monomorphic tachycardia with a pulse. So dito, anong sagot dito? Letter C. Unstable SVT. Monomorphic VT in a stable patient. Yes, pwedeng monomorphic pero it should have a pulse. Hindi naman sinabi ko meron siyang pulse. Stable patient lang. Ang sagot dito is letter C. Next, number 3. Which drug is preferred intervention for terminating a narrow complex tachycardias that are symptomatic but stable? Ano to? Narrow complex tachy pero stable. Ano yung diniscuss natin? 2Ps. In supraventricular in origin or SVT. Anong sagot dito? Epi, amio, atropine, adenosine. Adenosine. Ano yung dose mo na adenosine mo? 6, 12, 12. Okay, interval of 1 to 2 minutes. Next, adenosine should not be given to patients with asthma, pregnant women, patients with SVT, patients with narrow QRS with regular rhythm. Anong sagot? Tinatanong ka nito, contraindication ng adenosine. Adenosine may actually cause, diniscuss natin to, what? Bronchospasm. Therefore, adenosine should generally not be given with patients with asthma or COPD. This is according to your AHA Advanced Cardiovascular Life Support Provider Manual, page 143. Ang sagot dito is letter A. If SVT does not respond to vagal maneuver, so ineffective ang yung vagal maneuver, yung pwede dito yung cuff or yung CSM mo, how much adenosine do you give? Ang sagot mo dito, letter D. Okay, 6 milligrams rapid IV push over 1 second. Rapid. Now give adenosine 6 milligram as a rapid IV push over 1 second. Follow with 20 ml saline flush and elevate the arm immediately. Okay. Vagal maneuvers alone will terminate about what percentage of SVTs? 25%, 90%, 75%, 30%. Canon actually discussed this to you. Ang sabi ko, 25%. Kaya yung remaining, kailangan mo pa rin magbigay ng adenosine. The answer is A. Kung gusto mo i-check kung tama yung sagot natin, check mo yung AHA Advanced Cardiovascular Life Support Provider Manual, page 143. Next, number 7. With a blood pressure of 138/84, good color, a pulse ox. O2 saturation of 98% and a chief complaint of palpitation, you decide that this patient has, anong patient to? Pinapa-diagnose ka niya. Binigyan ka ng mga symptoms, ida-diagnose mo ang pasyente. Tanggalin na natin to. Hindi siya brady. Kasi bakit? Tingnan mo, Palpitation nga Nagpa-palpitate ba sa body? Hindi naman, di ba? More likely, hindi nagmamanifest yan. Saan ang palpitation? Sa tachy. Next, cardiac arrest. Cardiac arrest agad, stable nga Gigigil ako sa'yo. Nasaan ba yung term na stable? This is really how you're gonna do like an elimination process sa mga exam. And that's why I'm also teaching you how to do an elimination process. Ma-apply mo to kapag sa mga upcoming, alam mo naman sa nursing, napakaraming exams. Okay, good caller and a pulse and a chief complaint and you decided this patient is dito cardiac arrest. Stable supraventricular tachycardia. Yes. Why? Look at the blood pressure. 138/84. Is that less than or more than 90/60? It is more than, so stable yan. The answer is B. Next, number 8. The first step in managing this rhythm, itong rhythm na to, itong stable, SVT, in connection to question number 7 is what? Administer adenosine, 6 mg IV push, sedate the patient with diazepam, immediately perform synchronized cardioversion, perform carotid sinus massage. Okay. Anong first step mo? Naalala mo pa si 2Ps? Ano yung sabi doon? Physiologic and what? Pharmacology. Hindi ka agad mag-a-adeno. Gigigil ako sa'yo. So out na to. Isa-sedate mo pa. Saan tong sedation and synchronized cardiovert? Saan to? 2S. Sa unstable SVT. So anong gagawin mo? Initial step mo ng management, carotid sinus massage. Physiologic. Okay? Tandaan mo, kung magka-carotid sinus massage ka lang kapag less than 60 years old. Pero ang pasyente mo, if more than 60 years old, you let the patient cough. Okay. Now, next, number 9. If this does not improve the rhythm, so this, question number 8, if this does not improve the rhythm, a reasonable next intervention would be, hindi doon nag-improve yung carotid sinus massage mo. Ano to? Start sedation with diazepam? Are you gonna perform synchronized cardiovert or administer 6 mg of adenosine? Hala, kulang to, 6 mg of adenosine. Hala, sorry na. Dapat meron pala ditong adenosine. Pero sige, bonus question na to. Pero ang sagot dyan is D, hindi ko lang nalagay yung adenosine. Sorry na. Okay, but this one is bonus. Lagyan ko ditong bonus. Bakit? Sa mga exam naman talaga natin may mga bonus question na ba? Bonus na yan. So, hindi ka 0. Yes. Next, number 10. The nurse is preparing for synchronized cardioversion. The appropriate voltage for cardioverting SVT is what? The answer is letter C. Ano ba? Period. 50 to 100 joules. At saan ka nga nagsisynchronize cardiovert? Sa iyong unstable Barati. Yay! Thank you so much, you guys, for watching this one. I hope you learned something and you enjoy our today's discussion. Please watch out for more nursing educational contents that I'll be uploading on the coming days. So please like, share, and subscribe to my channel. You're already here, baby. You might as well subscribe. And then, yeah, I'll see you again on our next discussion. You stay safe.
Thank you so much, you guys, for watching. Hope you enjoyed this one. Help me grow my channel.
You're already here, you might as well subscribe. #TeenKuto.
Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists I created for you. I'll be putting the links on the description box or simply click this icon button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Galve. See you again, baby.